or in the listing of what you've been charged to do?
Well, I think that, there are different measures of severity and concern. Obviously, to pregnant women, those individuals in that state in their life, as I'm sure you can imagine, everything that happens during pregnancy is of real concern, and this is a condition that does warrant attention during pregnancy. It's a finite period. It's serious, but perhaps not the most frightening there are more serious conditions, of course, that can develop.
But there's certainly nothing that should be ignored at all. There shouldn't be it's just some minor thing.
It's clinically consequential. I mean, it's a real disease and it's a real concern during pregnancy. On the other hand, as indicated, it is time limited. It is, if you will, cured by the end of pregnancy. That ends the condition in a way that's quite different than, obviously, heart disease or cancer or kidney disease. That is something to be managed for a lifetime. This is a time-limited problem.
There's a couple other things, though, that you were looking at, though, that may be not part of this project, but further down the road, that there were a couple of other markers you might look at. How significant are those? Obviously not a conclusion, right, but you had three other things that, may have been very minor. Yeah.
I think that, there's a judgment made there about there's sort of these different levels of sort of assessment, and obviously probable link is what we're assigned to do. It's almost a different question. Is there something there that suggests more detailed research, more investigation, more study? I think that I think there are, again, as a researcher, of course, I think there's a lot of unanswered questions. This is not the final word, and there is more research that others are doing that's in progress. But I do think that particularly probably the birth weight, the small variation in birth weight is something that does seem to come up with some consistency, and it would be good to understand that better. I think that warrants, perhaps more than the other ones, more research.